Welcome to Notepad. I'm your host, Ibrahim Sani. We are entering the third phase of the movement control order. This also means that we are entering one whole month of being locked down at our homes. How does this reflect on our mental health? Are we truly, while being protected by physical ailments, are we truly protected in terms of our sanity? Particularly so when we have close quarters living among us. We have issues of having to go to work, figuratively speaking, at our workstations or at our desk, at our living room. But at the same time, we have to cook and clean. We have to ensure that our kids attend their online classes and many others. These have indeed been the new normal for us. And the Prime Minister has indeed tried to address the new normal and the fact that we have to think about doing things differently in the near term. That's why we have to understand how we are going to keep ourselves going under such trying times. This episode will focus a little bit about the mental health situation of not just the country, but of our household, of our homes, and how we carry ourselves forward in terms of keeping ourselves mentally active and mentally sane. Joining me in this episode is Dr Nora Issa. She is a psychiatrist at Hospital Selayang. She's also, of course, a lecturer of the Medicine Faculty of Medicine, UiTM. Thanks, Dr. Faizah, for joining us. Let's understand a little bit about the situation of the medical fraternity when it comes to the psychiatric treatment at the hospitals. Where are we on this particular topic?
All right. Thank you, Ibrahim, for having me. First of all, I think we should all continue praying and so that we can all get through this challenging time with COVID-19 together. About your question regarding the situation or in a hospital in regards to our mental health issues, well, as we can expect, with the MCO, with the movement control order at the moment being extended to the third phase, it has created a lot of uncertainties. There's a lot of changes that need to be made, and that all can result to the social isolation among all of us. This is indeed a very difficult situation, and these three factors, uncertainties, needing to make a lot of changes, and social isolation are known to be the risk factors that can worsen, mental health, especially anxiety and depression. As we can expect, with the extension of the MCO, they should be an increase of mental health challenges among us, especially those that are vulnerable. For example, those who have the pre-existing mental health issues, those who are living in isolation, and those who have poor support, and those who have difficulty in coping with stress. And therefore, like I said, the number of cases is expected to increase. And if you can see in the literature review, one of the studies published in the Journal of American Medical Association, worrying and also social isolation can actually worsen anxiety and depression. We actually see that in our own local setting. However, the challenges that we have now in providing intervention or treatment, or in supporting those who are struggling, is a bit of a challenge if we want to use the traditional model, because, as you know, we try to limit the best that we can patients coming into the hospital because of the risk when they come to the hospital, or them being admitted to the ward. There's a risk of interaction and the risk of contracting the COVID-19 infection. So it is something that we all try to work together. And in UiTM, for example, at the moment, how we try to support our patients is by doing our clinic not face-to-face, but through teleconsultation, in which we will call our patients and screen their mental state, and those who are really at risk, only then we will call them for face-to-face consultation. Looking at our staff, our academic staff, our nurses, our doctors, we noted as expected, there's an increase of level of anxiety. Therefore, our department, the Department of Psychiatry in UiTM, were actually providing what we call it the psychological first aid support, circle of care, in which we try to support them through the social, through the online medium, for example, the WhatsApp group, and also again through the telephone call with them.
Dr. Faizah, the care of psychiatry requires human-to-human contact. We know that under your discipline, it's important to have face-to-face communication, human interaction, many others. But because of the MCO, things are going to be done a little bit differently. How do you render your care and your service? How do you ensure that your patients and the people that you talk to are indeed well taken care of via online means? This is not something that is common in terms of psychiatry. How do you ensure that care and treatment can be done without any human intervention?
Okay. That's a very relevant question, because you see, naturally we are social beings, right? We need to interact with each other. In fact, we need to move, and we should have the freedom to do whatever that we can. However, with the current MCO, even to actually give treatment specifically to psychiatric patient is very important. We have to use the non-traditional way. We have to utilize the best method that we can. For example, using the online telephone calls, and even video calling them. It's not ideal, but that's the best that we can. Of course, there are some limitations, and a lot of considerations need to be taken into consideration. For example, the issues of confidentiality and how accurate is our assessment if we are doing it through the phone or through the the video call. However, we try, as the time passes, we feel that we are getting better in communicating more effectively using that medium instead of the traditional face-to-face consultation. There's a lot of adjustment, but I think definitely we are progressing well, and we are adapting to the new normal now in interacting with our patients.
Let's take a look into the impact of the healthcare system in Malaysia. We know now that the active cases in Malaysia is around 2,500 cases. This requires them to have hospital beds, access to ICU, respiratory systems, and many others. Do you think that the government is doing enough in terms of balancing healthcare between psychiatric patients with that of those requiring treatment from COVID-19, as well as many other ailments right now? Do you think that we have the necessary balance to treat infectious diseases patients as well as other cases as well?
Okay. I think our government is doing a very good job in balancing the care of to prioritize prioritize and also to limit the spread of COVID-19, and to prepare the facilities, the services to actually so that we can treat the outbreak as effectively as possible. Of course, other disciplines of medicine are affected. For example, we have hospital who has closed down their operation theatre for elective cases. Some of the medical staff are being deployed to the COVID hospital. Yes, but I think we should all take this as a challenge that we should overcome as a team. Those who has been deployed to to deal with COVID-19 should they are trying their best, and those who are not directly involved, we should do our best as well to care for the non-COVID cases, the best that we can. However, it is important to emphasize that I don't think any discipline is being backsided. We treat all patients, all illness pretty much the same, as important, as important, because health does. As for now, maybe COVID is the most important, the one is the one that we focus on, but others are still run as much as possible, especially the emergency cases. And we will try to improve our services, try to improve our resources as the time passes, and try to do the best that we can for the country, for the patients.
Let's talk a little bit about the realities of things when we talk about the actual numbers. Is it really going up or going down in terms of people getting mentally unhealthy in this time?
As I mentioned just now, it is expected, and it has been captured in a few studies that have been done, particularly in overseas setting. As I mentioned just now, the study done and published in the Journal of the American Medical Association, there's an increase of the cases of anxiety and depression. And looking at things locally as well, we have been getting a lot of, getting a lot of calls for consultation of people who are struggling with their emotion, with their psychological and emotional state when faced with this COVID-19, and also with the social isolation of the MCO.
Okay. We'll take a short break, Dr. Faizah. When we come back, we'll discuss more about mental health care, in particular about psychosocial support. Don't go anywhere.